And now, a moment of education from SURGUCATION.
The most common reason that a child would need ear tubes is either for recurrent or difficult ear infections or for fluid that stays in the middle ear. Usually your doctor, either your pediatrician or your specialist doctor, an ear, nose, and throat doctor, would be able to look at your child's ear. Sometimes it's based on the history that you tell the doctor, whether your child's had multiple ear infections, what the infections have been like, if there's any hearing difficulties, balance difficulties, difficulties taking antibiotics, or other concerns that your doctor may ask you. In the clinic, your doctor can look at the ears with an otoscope, a small instrument that looks with light into your child's ear. There, they would be able to tell you if your child had an infection or if there was fluid in the middle part of the ear.